I have a couple follow-up questions with that, but just so that even further people understand a little bit more of the use cases
Yeah,
that why this is important. Can you talk about some of the things that you're doing? One is quality review. You have gap closure. You have risk adjustment audit. Can
yeah,
you maybe help people understand a little bit more about what those are and why they're important?
yeah. Yeah, I mean, I think if your audience is a kind of an investor audience, right, is trying to understand the problem or the opportunity. So for roughly $4 trillion being spent on healthcare, government sponsored care, which is the markets that we participate in, Medicare, Medicaid, kind of ACA marketplace, affectionately called Obamacare. Those three being kind of the lion's share of it. Within that, there are hundreds of billions of dollars a year that are at stake around quality bonuses and around these risk adjustment premiums, right? And the way it swings the amount of money they get per member per month for members that they have insured. And the analysis that we did about a year ago would estimate that on average it's $400 to $500 million a year per health plan. 400 to 500 million per health plan per year. And so we are there to help them capture the money that is appropriate for them to receive. And I really want to emphasize that, we're out there to make sure that the health plans that are doing a great job in caring for their members can best represent that. And what you don't want to have happen is a health plan work really hard to get a member of theirs into a provider's office so they can be seen and get a care plan in place, and then not to be able to demonstrate that back later. So they'll often start with claims data, and that's an important place to start. But the medical record is super important in being able to identify that they were seen. Were they seen in the calendar year? Was a care plan put in place? Was there follow-up around it? Did they have their, did they go out and have their immunizations, right? If they had medication prescribed, right? Did they get it fulfilled? And we want to make sure that that information is captured and then ultimately summarized and then, served up to kind of regulatory bodies. And there's, national bodies, but there's also state bonuses as well for many health plans.